Breast cancer is a formidable foe, casting a shadow across the globe. It is the most common cancer in women worldwide. Each year, millions of women are diagnosed. Many lose their lives to this disease. Nigeria, unfortunately, faces a particularly heavy burden. Breast cancer is the leading cause of cancer death for Nigerian women. It accounts for a significant portion of new cancer cases annually. The statistics are alarming and highlight the urgent need for action. The high mortality rate from breast cancer in Nigeria is particularly concerning. This can be attributed in part to late diagnosis. Many women present with advanced stages of the disease when treatment options are limited. This emphasizes the need for early detection and timely access to quality care. The fight against breast cancer is not just about statistics. It is about real women facing a life-altering diagnosis. Their stories are a powerful reminder of the human toll of this disease. Their struggles and triumphs offer valuable lessons in resilience. Their voices must be heard. Their experiences must inform our efforts. Together, we must strive for a future where breast cancer is no longer a threat to the women of Nigeria. To effectively combat breast cancer, it's crucial to understand what puts women at risk. Some factors are beyond our control, like genetics. A family history of breast cancer can significantly increase a woman's risk. This is because certain genes, passed down through generations, can make cells more likely to grow abnormally and become cancerous. Age is another significant factor. As women grow older, their risk of developing breast cancer increases. This is why regular screenings and self-examinations become even more critical with age. Lifestyle choices also play a role. Maintaining a healthy weight through diet and exercise can lower the risk. Conversely, smoking, excessive alcohol consumption, and a diet high in processed foods can increase it. Environmental factors, though often overlooked, are also important. Exposure to certain chemicals and pollutants can increase the risk of breast cancer. This highlights the need for greater awareness of environmental health hazards and their potential impact on our well-being. Understanding these risk factors is the first step towards prevention and early detection. In Nigeria, as in many parts of the world, a lack of knowledge about breast cancer poses a significant challenge. Many women are unaware of the risk factors, the importance of early detection, or even the symptoms of the disease. This lack of awareness can have devastating consequences. When women don't know the signs, they are more likely to delay seeking medical help. This delay allows the cancer to progress, making treatment more difficult and less effective. Bridging this information gap is crucial. We need to empower women with the knowledge to protect themselves. Comprehensive educational programs are essential. These programs should be tailored to the specific needs of Nigerian women. They should be offered in local languages and accessible to both urban and rural communities. It's not just about providing information. It's about dispelling myths and misconceptions surrounding breast cancer. Open dialogues and community engagement are key. We need to create an environment where women feel comfortable asking questions and seeking help without fear of stigma or shame. Knowledge is power, and in the fight against breast cancer, it can be a lifesaver. Sadly, knowledge alone is not enough. Women in Nigeria face numerous barriers when it comes to breast cancer care. One of the most significant is stigma. The disease is often shrouded in silence, considered taboo to discuss openly. This silence can be deadly. Women may be reluctant to seek help due to fear of social isolation, discrimination, or even abandonment by their families. The stigma surrounding breast cancer is a societal issue that needs to be addressed head-on. We need to create a supportive environment where women feel empowered to share their experiences. Public awareness campaigns, led by survivors and advocates, can help break down these harmful stigmas. Access to quality healthcare is another major challenge. Many women, especially those in rural areas, lack access to timely and affordable screening, diagnosis, and treatment services. This disparity in healthcare access is unacceptable. We need to strengthen the healthcare infrastructure, particularly in underserved communities. This includes training more healthcare professionals, equipping hospitals with modern technology, and making cancer care more affordable and accessible to all women. Section 5: A Nation's Response Combating Cancer in Nigeria. Despite these challenges, Nigeria is not standing idly by. The government, along with various organizations, is taking steps to combat cancer and improve the lives of women affected by the disease. There's a growing recognition of the urgency of the situation, and efforts are underway to strengthen the country's cancer control capacity. One key initiative is the establishment of more comprehensive cancer treatment centers across the country. These centers provide a wide range of services, from diagnosis to treatment and palliative care, all under one roof. This makes it easier for patients to access the care they need. There is also a push to integrate cancer prevention and early detection programs into primary healthcare services. This means that women can get screened for breast cancer during their routine checkups, increasing the chances of early detection. Early detection is crucial. When breast cancer is found early, before it has had a chance to spread, treatment is more likely to be successful. Section 6. Charting the course. Recommendations for improvement. While these efforts are commendable, there is always more that can be done. Addressing the breast cancer crisis in Nigeria requires a multi-pronged approach. First and foremost, we need to significantly increase funding for cancer research, prevention, and treatment programs. This funding is crucial for developing new and more effective treatments, as well as for making existing treatments more accessible. We also need to invest in training more healthcare professionals, particularly oncologists, nurses, and technicians specializing in cancer care. This will help address the shortage of qualified personnel, especially in rural areas. Public awareness campaigns are vital. We need to educate women about the importance of regular screenings, self-examinations, and early detection. These campaigns should be culturally sensitive and tailored to reach women in both urban and rural communities. Finally, we need to continue challenging the stigma surrounding breast cancer. Creating a supportive environment where women feel empowered to talk about their experiences is essential for early detection and timely treatment. Section 7. Stories of strength, resilience in the face of adversity. In the face of these challenges, the strength and resilience of Nigerian women shine through. Their stories are a testament to the indomitable human spirit. Many women facing a breast cancer diagnosis find strength in their faith, their families, and their communities. They lean on each other for support, sharing their experiences and offering words of encouragement. Their strength is not just about survival, it's about thriving. It's about embracing life with renewed purpose and determination. These women become beacons of hope for others, showing that it is possible to navigate the challenges of breast cancer and come out stronger on the other side. Their stories are a powerful reminder that we are not alone in this fight. They inspire us to continue pushing for better prevention, early detection, and treatment options for all women. Their resilience gives us hope for a future where breast cancer is no longer a threat to the women of Nigeria. By sharing their stories, we amplify their voices and honor their strength. Section 8. Faith and Fellowship. Sources of comfort and support. Religion plays a significant role in the lives of many Nigerian women. In times of crisis, faith becomes an anchor, providing comfort, strength, and hope. For women battling breast cancer, their faith communities often become a lifeline. Churches and mosques offer not only spiritual guidance but also practical support. This might include financial assistance, transportation to medical appointments, or simply a shoulder to cry on. The power of collective prayer and the unwavering belief in a higher power can provide immense solace during difficult times. Support groups, both within and outside religious institutions, also play a vital role. These groups offer a safe space for women to connect, share their experiences, and find strength in shared journeys. Knowing that they are not alone, that others understand their fears and anxieties, can make a world of difference. These groups often provide practical advice on coping with treatment side effects, navigating the healthcare system, and maintaining a positive outlook. The power of human connection and shared experiences can be incredibly healing. Section 9. A Future of Hope, Empowering Women, Transforming Lives. The fight against breast cancer in Nigeria is far from over, but there is hope on the horizon. With continued investment in research, healthcare infrastructure, and public awareness campaigns, we can create a future where every woman has the knowledge and resources to protect herself. We need to empower women to take charge of their health. This means providing access to accurate information, affordable screenings, and timely treatment. It also means breaking down the stigma surrounding breast cancer, creating a supportive environment where women feel comfortable seeking help. The journey may be long, but together, we can make a difference. We can change the narrative around breast cancer in Nigeria. we can transform lives. Let us continue to work tirelessly, with compassion and determination, to create a future where breast cancer is no longer a threat to the women of Nigeria.